It is an honor to introduce our first speaker for today. She holds a bachelor degree in science in biology and earned her Doctor of Medicine from the University of the Philippines. She is an active OB-GYN consultant with specialization in pediatric adolescent gynecology and functional aesthetic gynecology at Makati Medical Center. She has been invited to speak at several seminars and conferences on gynecological health, including VChat series, perimenopause, menopause, and intimacy, evolved sex in the golden years, to mention a few. She received several recognitions, and one of her current is that she is one of the 22 empowered women by the Global Women Who Rule last May 2024. It is with great honor that she accepted this invitation despite her busy schedule to talk about comprehensive understanding and management of polycystic ovarian syndrome. Let's all welcome to the virtual stage an OB-gynecologist, founder and director of Aherrera Wellness Group, Dr. Annebelle D. Aherrera.
Good afternoon, everyone. I am delighted to be with you. So we shall begin. What is polycystic ovarian syndrome? It is a complex, intriguing endocrine disorder characterized by the following. Don't get overwhelmed by the terms. I will explain them each one as I go through this lecture. Just remember the four important components of polycystic ovarian syndrome, or Pcos, namely hyperandrogenism, menstrual abnormalities, polycystic ovaries, chronic anovulation, and decreased fertility. Your endocrine system, as you all know, is in charge of creating and releasing hormones to maintain the different bodily functions in our system. It is normally seen in the reproductive age. Between 5 and 10% of women between the reproductive age of 15 and 44 or childbearing age have Pcos. At times, Pcos is discovered between 20 to 30 years of age. More commonly, it has become an issue, particularly in women or ladies who just had their menstruation. So remember, Pcos can occur anytime after puberty. And you know that puberty is when you have already menstruated. What about the risk of Pcos? Women of all races and ethnicities are at risk. Japanese, Asian, Caucasians, Africans, all ethnicities are at risk of Pcos. Furthermore, your risk is higher if you have a family history of diabetes, obesity, insulin resistance, or you have a mother, aunt, or sister with a history of Pcos. What is the cause of Pcos? It is unknown, but most experts think that several factors that cause Pcos, number one, is genetics. That's why in my practice, I see more of these patients with Pcos with an existing family history of diabetes. Pcos is something you are born with. Remember that. Whether you have a family history of diabetes, but you are obese, or you have insulin resistance, you are at risk of developing Pcos. Let us focus on the endocrine system. As I did mention earlier, your endocrine system, as you can see in this slide, is in charge of creating and releasing hormones in the body. Your endocrine tissues, more focused here, are from the pituitary gland, thyroid, pancreas, and the ovaries. Today, this afternoon, we will focus on the pituitary gland, the pancreas, and the ovaries. And if there is any disruption in creating and releasing of these hormones in these tissues, it will result in hormonal imbalance. Just a little biology 101 for you to understand and will be a helpful guide. This is a female reproductive system that consists of your internal structures. I will focus on that in a while. And your external structures, that's your external genitalia. Your internal structures are your uterus, fallopian tube, and your ovaries. Simply put, your Pcos is an imbalance of the reproductive hormones that create problems within your ovaries. So let us focus first on the local setting, that is the ovaries. Let us review the normal menstrual cycle for you to understand the different characterizations of Pcos. Remember, there are two hormones that are produced by your ovaries during your reproductive and childbearing age. These are estrogen and progesterone. Remember, the uterus functions only to prepare itself for a possible pregnancy. Kaya ang tawag sa kanya ay bahay bata. It only carries a pregnancy. It does not produce any hormone. In a normal menstrual cycle, estrogen that is released from your ovary, what does it do? It has two functions. It prepares the uterus by thickening the lining of the uterus in case fertilization of an egg is fertilized by a sperm. So number one, pinapakapal niya yung lining ng matres. Number two, your estrogen assists in increasing the size of your follicles that are found in the ovaries in the hope that one of these follicles that contain the egg will mature to a certain size, and when it reaches a certain measurement, that egg is released in a process called ovulation. So when the egg is released, from the ovary, it goes through the fallopian tubes. Okay, bumibilis yung slides ko. And when the egg, which is found here in the fallopian tube, still waits for a possible fertilization by the sperm that swims within the vaginal canal into the uterine cavity, if fertilization takes place, then the egg now is brought down into the uterus and pregnancy occurs. What happens if the egg, is not fertilized? Yes, I can hear some of you saying that that egg will diminish, disintegrate, together with the thickened lining of the uterus and will turn into menstrual debris. However, you must remember one important thing. When ovulation takes place, another hormone is released, and that is your progesterone. Your progesterone is important. If fertilization takes place, progesterone is increased to ensure that implantation of the pregnancy is completed and is enhanced. If, however, the egg is not fertilized by any sperm, that egg will disintegrate, progesterone will slough off. Para siyang kutsilyo, tinatanggal niya yung makakapal na area ng matres together with the disintegrated egg into your menstrual debris. Okay, I will repeat. There should be a balance between your progesterone and your estrogen. Women with Pcos, the egg does not develop. There is no follicular maturation. If there is no follicular maturation, the egg is not released. There is no ovulation. When there is no ovulation, there is lack or absence of your progesterone, and therefore there is an imbalance of your estrogen and progesterone manifested by menstrual irregularities. So that is the cause of one of your reasons for Pcos, menstrual irregularities from the imbalance of your estrogen and progesterone in the ovaries, in the local setting of your ovaries. Now, the next slide. In an upper setting, there is an interplay of hormones coming from the hypothalamus and the pituitary gland. There are chemical messengers that come from these areas that stimulate further the production of the important function existing in your ovaries. And two of these hormones are the following. Your luteinizing hormone, which is responsible for ovulation, and your FSH, or the follicular stimulating hormone, that is responsible for maturity of your egg follicles. So tandaan nyo, on a higher level, you have your two hormones. Now, what happens in Pcos? So dapat may balance yan. Your LH must be in level with your FSH to ensure ovulation, follicular maturation and ovulation. What happens in Pcos? There is now an imbalance because there is an increased or higher level of your LH, resulting in the low follicular stimulating hormone. So if you have low FSH, it will prevent the follicles from maturing, and therefore it will result in unviable ovulatory process. So there will be anovulation. Furthermore, the ovaries, because of the follicles that do not mature, these follicles will now turn into cystic areas, fluid-filled cystic areas caused by your high level of LH. This high level of LH will now, be sensitive to an increased level of male hormones called androgens. Okay, I hope you can still follow me. Women with Pcos, again, I will repeat, have high levels of LH, low levels of FSH. Doing so will result in poor egg development, inability to ovulate, and the increase in your LH will produce the cystic follicles in your ovaries that will produce more male hormones. So the effect is hyperandrogenism. What are the high levels of androgens? Male hormones ito. Women with Pcos will have higher levels because no egg is released. And when you have high levels of androgens, what do you notice? There is hirsutism. Dumadami ang buhok, dumadami ang acne para tayong nagiging lalaki. Pero hindi nagbabago ang boses. Yung mga physical features lang ang nakikita. Okay, so we already know, on the local setting, you have menstrual irregularities. On a higher level setting, you have hyperandrogenism. And those small cystic follicles that will increase fluid-filled areas will be seen as polycystic ovaries by ultrasound. Okay? And because of the anovulatory process, there is chronic anovulation. There is no egg that is released. Okay. Now let us focus naman on another endocrine tissue, which is your pancreas. What does your pancreas produce? It produces insulin. We all know that insulin is the hormone that regulates the sugar in our blood. And blood sugar, remember, is your primary energy supply. Women with Pcos may what we call have insulin resistance. What happens? Okay, our body cells become resistant to the action of insulin. So when it becomes resistant to the action of insulin, your pancreas will produce more insulin, okay, because your blood sugar may rise. It will produce more insulin. So the more insulin you have, it becomes high in the blood level. Remember, your insulin is also responsible for other functions in the body parts. Okay. It also is regulated in the muscle. Okay. So if you have insulin resistance, especially in the skeletal muscles, anong nangyayari? Tumataba, nagiging obese. You have weight gain. That is the effect of high levels of insulin in the blood. Insulin resistance will cause, okay, it will cause the obesity and the weight gain. Furthermore, insulin will also affect the ovaries on a local setting. It makes the cells or the ovaries more sensitive to luteinizing hormone. And we already know that the luteinizing hormone, okay, produces more androgen. So your excess insulin makes it more sensitive to LH, thereby exacerbating your androgenism. So what happens? You have excess insulin levels, serum insulin levels are high. You have insulin resistance. Now what happens? It is no longer geared towards the female hormones, estrogen and progesterone. It is now geared towards the male hormones, resulting in acne, hirsutism, hairiness, obesity, weight gain, and because of the imbalance of your estrogen and your progesterone, you have menstrual irregularities. Okay, I hope you follow me with that. Okay. Now, it was said that low-grade inflammation, what is this? It is the term used to describe white blood cells that are being produced more in the blood system. Research has shown that women with Pcos have a type of low-grade inflammation that stimulates the polycystic ovaries to produce androgens, okay? And therefore can lead to heart and blood vessel problems. This can be an underlying cause of your metabolic syndrome. It is also found that research says that certain genes might be linked to Pcos. In my clinical practice, I may have patients who do not present with Pcos or diabetes, but may present with menstrual irregularities and hyperandrogenism, and may not even have insulin resistance, but may manifest this, okay, PCOS based on polycystic ovaries and hirsutism. So I would like to say more often than not, patients that I see in my clinical practice always have an underlying history of diabetes. Obesity. This is encountered in 30 to 70% of PCOS-affected women, and its presence significantly modifies the clinical aspect and the laboratory expression of this syndrome. PCOS is closely linked to obesity. Okay, remember that. It increases your insulin level and it even makes your symptoms worse. What are the clinical signs of PCOS? Obesity, hirsutism. It is not enough na mabalbon kayo sa arms or the legs. Typically, you will see the male pattern hair growth in women. That is dumadami ang buhok sa upper lip. There is balding of the temporal hairline. And this is very typical. The picture here on the right of your screen is the acanthosis nigricans on the area where you will see hyperpigmentation. Now, this is very common. You will see patients who are obese look at the back of their necks. If they have acanthosis nigricans, more often than not, you clinch the diagnosis of PCOS. And then other signs would be acne, okay, irregular menses, and temporal hair thinning. Numinipis dito. Okay. Okay, this is interesting. I would like to tell Ma'am Bebot. Fatigue is one of the leading symptoms reported among women with PCOS. And I don't know how many of our nursing staff will complain of fatigue and sasabihin nila, ay kasi may PCOS ako. It may be one of the leading symptoms, but there's really no proof or scientific reason why it is related. But clinical symptoms of fatigue may be associated with PCOS. Additional causes of fatigue may be an underactive thyroid. That's why patients who have irregular menses, who complain of hyperandrogenism, hairiness, we also include to test for thyroid function. Low vitamin B12 or vitamin D levels. Yes, vitamin D now is associated, it is an antioxidant, and even in researches now, vitamin D is really a good supplement, not only for patients with endometriosis, but patients who are diagnosed with PCOS, probably because of that low-grade inflammation that exists in the blood vessels. Okay. So if you are feeling exhausted and you lack the energy to do what you used to do, maybe we can consider PCOS as an underlying reason. Sleep also can affect energy, mood, and other symptoms such as pain. What about stress? PCOS itself is known to cause stress, particularly when you have excessive facial and body hair, acne, and darkened patches of skin. And because of this stress, it leads to our mental, it affects our mental wellness. It can lead to anxiety and depression. And this is more likely seen in younger women because the younger women would like always to look young, good, sassy, okay, and glamorous. So yes, it may be a cause of stress. So when you have PCOS, okay, treat it immediately. so it does not domino into this into this affectation. Now, what are the complications that we may see? Because of the anovulation, because there is an imbalance in the ovarian hormones. Remember, your progesterone may either be low or markedly absent. So tumataas yung levels of estrogen, kumakapal yung lining ng uterus. So what happens? You may be at risk of abnormal uterine bleeding, endometrial hyperplasia, and may lead to endometrial cancer. Apart from this, obesity, the more obese you are, the more insulin you produce, the higher your risk of insulin resistance. And because of this, diabetes may come into place and may lead to the metabolic syndrome, hirsutism, and long-term risks of hypertension and high levels of cholesterol and triglycerides, or hyperlipidemia. What are the other linked issues with Pcos? Of course, due to the anovulation, it can result in infertility. Gestational diabetes or pregnancy-induced high blood pressure can be seen in patients who are pregnant but has had a previous history of Pcos. Miscarriages or premature birth can also be linked, all right? Non-alcoholic steatohepatitis, okay, that's too highfalutin. All it means, fatty liver. It can lead to severe liver inflammation caused by fat accumulation in the liver. Others, okay, I've mentioned, it can lead to metabolic syndrome. Sleep apnea. Pcos can also lead to sleep apnea. A momentary and repeated stops in breathing pattern is interrupted. And it is probably because of the weight gain and obesity. Depression, anxiety, I've spoken about that. Now, women out there in the audience might ask, what about Pcos and menopause? Pcos is hormonal imbalance that does not change with age. So you may still have symptoms of Pcos. But studies have shown that women with Pcos find that their menstrual cycles have become more regular when they come closer to menopause. There's no scientific reason why, but definitely there is really still an imbalance that exists with age. Also, the risks of Pcos-related health problems, diabetes, stroke, heart attack, will increase with age. And therefore, these risks may be higher in women with Pcos than without. What about the diagnosis? There is no single test to diagnose Pcos. There is no test to definitely diagnose Pcos. Okay, I have to emphasize this, ladies and gentlemen. There is a need when you go and have yourself checked, or when you explain and you encounter patients with Pcos. It is important to have a complete discussion of the medical history, menstrual periods, the weight changes, family history. A physical exam is important to check for excess hair growth, insulin resistance, acne, and skin discoloration. There is a need for a pelvic examination. Blood tests that should include fasting serum insulin, DHEAS, that is to determine the levels of your male androgenism, FSH and LH, just to see the balance between your chemical messengers coming from the pituitary gland. And the last would be the ultrasound of the uterus and ovaries. I need to emphasize this. I have patients who come to me and tell me, Doktora, may Pcos po ako. Okay, so how did you know that? Kasi meron po akong ultrasound. Nagsasabing polycystic ovaries po ako. That does not conclude you have Pcos. Remember, the next diagnosis for Pcos should entail 2 out of 3 of the criteria I will talk about. And these are the following. I prefer using the Rotterdam criteria, where 2 out of the 3 hyperandrogenism, this is evidenced by your hirsutism, acne. This is evidenced by your blood test, your DHEAS. This is evidenced by the possibility of your high levels of serum insulin. Number 2, you have menstrual irregularities. So it is important. Hindi yung, ay kakamens ko lang po. Monthly ho ako nagkakaregla. No. It is important to determine the dates, the interval dates between 2 menstrual periods. Hindi pwede yung, ay doktora, first week of the month ho ako nagre-regla. Tapos last week of the month nagre-regla ho ako. I want to emphasize, when you give your menstrual history, you need to give the first day of your last normal menstruation and the first day of your previous menstruation. There should be an interval of 28 to 32 days in between 2 menstrual cycles. If you have intervals that are less than 28 days, or more than 32 days, that is what you will diagnose as menstrual irregularities. Okay? So it is important to be makulit. You need to know the dates. And number 3, polycystic ovaries on ultrasound is also important. So I do not diagnose patients. Please, ladies, huwag niyong isipin pag may Pcos kayo by ultrasound, may Pcos na kayo already. No, that is only an ultrasonographic finding. Now look at the other criteria by other programs. The Androgen Excess Pcos Society criteria, they only have 2. That's hyperandrogenism and menstrual irregularity or polycystic by ultrasound. The other, the National Institute of Health criteria, is hyperandrogenism and menstrual irregularity. I will be dependent on the Rotterdam criteria of 2 out of 3. So if there's anything that you should remember today, it is this: hyperandrogenism, menstrual irregularity, polycystic ovaries by ultrasound. What are the long-term goals? There is no cure for Pcos. You need to manage the symptoms of Pcos. Number 1, long-term, you need to control your hyperandrogenic features: hirsutism, acne, scalp hair loss. 2, you need to manage the possibility of the progression of your insulin resistance to a metabolic abnormality. That means type 2 diabetes or cardiovascular disease. 3, you need to prevent the pathophysiologic complications. That is, chronic anovulation, thickening of the lining of the uterus, resulting in abnormal uterine bleeding, or may result in endometrial hyperplasia that may cause eventual carcinoma. These are the long-term goals. What are the specific treatment goals? Number 1, let us go to the local setting, that is your ovaries. There is a need to regulate your menstrual cycle by ensuring you have a balance of your estrogen and your progesterone. What do you do? How do you do that? you can actually give your oral contraceptives. It is a combined estrogen and progestin oral contraceptive pills. Again, by this, it decreases your androgen production in the theca cells of your ovaries, and it will also regulate your estrogen levels. And in the hope, okay, it can protect the lining of the uterus and prevent abnormal uterine bleeding. Number 2, if women out there have Pcos, they are single, they have they're not in a hurry to get pregnant, yes, you can actually give your oral contraceptives, your COC. But what about those who want to get pregnant and were diagnosed with Pcos? Do not despair. You don't have to be given oral contraceptive. You can be given progestin therapy. That is pure progesterone therapy until such time that your menstrual cycles become regular. These progestin therapies can be given, the progestin tablets can be given only at a certain time of your menstrual cycle. So it will actually help you. It will protect also your uterus from becoming thick or becoming thickened and resulting in abnormal uterine bleeding. Also, it will help you because this is what I use for my patients with Pcos who want to get pregnant. Okay? Because it is not only enough that we treat the menstrual irregularity pag may Pcos. Remember, may iba pang factors yan, yung insulin resistance. Okay, so this is where we're gonna come in now. Next, specific treatment goals, hyperandrogenism. Okay, remember, your androgenism, hyperandrogenism comes from your LH levels that are high. It stimulates your theca cells in your ovaries to produce more androgens, more going towards your male androgens, okay? So, number 1, we need to control hirsutism. There are medications to be given. The pills can also decrease your androgen production. And one of these, I think you are all aware of this, is your cyproterone acetate. Examples are Diane, Althea, Cybele. Kaya nang binibigay sa inyo if you have acne or excess hair. They give this particularly to decrease your androgen production. There are also medications now that include spironolactone. What is this? This actually is recommended to block the effects of androgen on the skin. Now, we shy away from giving this as a pure medication because you cannot give this in patients who may get pregnant because may cause birth defects. So there is a pill that can actually, okay, act like your spironolactones. And what are these? These are your Yaz. These are your drospirenones, your Yaz, your Yasmin, your Liza, your Lizel. So you see, there are many medications that can help, okay, treat your hyperandrogenism together with your menstrual irregularities. Now, what about those with really excessive hair? You can do electrolysis. Ano ba yung electrolysis? Sinusunog, naglalagay ng electric current on the hair follicle to damage it, to destroy the hair follicle. But you will need multiple treatments. Of course, waxing can help, but still the underlying treatment specific goal would still be medications. Another specific goal, ovulation. Okay, alam nyo na, we can give medications to improve your ovulation And what are these? Clomiphene, letrozole, okay? And even before giving that, in my practice, before you give all these ovulation induction medication, let's go back to the pathophysiology. Okay. Ginagamot na natin yung hyperandrogenism. Ginagamot na natin yung menstrual irregularities. But what about the anovulation? We want to improve insulin resistance because insulin resistance, that's why patients with Pcos, we always ask for your blood test. Because if the levels of your insulin is high in the blood, the treatment is metformin. Metformin is very effective in lowering the levels of your insulin from the blood and thereby lowering your levels of your androgen. So there is no need to give your ovulation induction medications like clomiphene and letrozole unless you are in a fertility workup where you were previously diagnosed with Pcos. I hope that is understood. Okay? Now, your treatment goals will only be achieved by your doctor. That's why in my practice, I always say Pcos has four-pronged treatment. Menstrual irregularities treated, insulin resistance is treated with medication. But the remaining two belong to you. It is you who have the bigger treatment plan than the doctor. Your lifestyle has to change and has to be towards the following: weight reduction to control insulin resistance and to minimize hyperandrogenism. So how do you do that? Number one, lose weight. Ang hirap niyan kasi ang sarap kumain. Tapos pag nagjo-duty, pagod na pagod. You are fatigued. It's related with Pcos, so you just like to eat. No. Healthy eating habits together with your regular physical activity can relieve you of your Pcos-related symptoms. Lose weight. Maintain a healthy weight. How do you do that? You try to lose 10% of your body weight. For example, 150 pounds ka. Just lose 15 pounds. And what will happen? This will result in lowering your blood glucose levels. It will reduce your insulin levels. It will reduce your androgen levels and may restore your ovulation, and your periods will come back to normal. Losing weight means you have to cut on what you eat. Dieta, diet. I will talk about that in a while. So that is weight reduction. Next, exercise. Be active. Exercise means you need to get out, sweat it out. If you're in the floors, yung mga nurses sa floors, umikot-ikot lang kayo doon sa nursing station. Ilang beses hanggang makita kayo ni Ma'am Susan na paikot-ikot kayo dyan. That is enough exercise. You sweat it out. At least exercise for at least 30 minutes, 3 to 4 times a week. That is moderate exercise. Brisk walking, jogging, cycling. These are all great activities that will help reduce your Pcos-related symptoms. Teka, baka naman isipin nyo, I have to take an intense workout. No, you don't do that. An intense workout will make you physically stressed and will make your body cling more to fat cells. So it has to be moderate exercise. That is walking up and down the stairs. Huwag na kayong mag-elevator. Up and down the stairs na lang po tayo. Diet. Okay, ito na ang pinaka-importante. You need to choose nutritious, high-fiber carbohydrates. Huwag na yung mga chocolates, cupcakes, donuts. Huwag nang dumaan sa Krispy Kreme dyan sa third floor. Bababa na lang kayo up and down. Kumuha na lang kayo ng tinapay dyan saan ba yung Cafe France? Meron bang bread doon? Maybe isang croissant, or punta na lang kayo sa Uncle John's. Huwag na yung mga pritong chicken. That's high carbohydrate diets. That will increase your insulin levels. You need to choose complex carbohydrates. Okay? Number 2, I want you to look at your palm. Hindi kamay, your palm. Your palm should be used as your server every time you eat. Ganyang kalaki lang ang inyong protein, ganyang kalaki lang ang inyong fruits, ganyang kalaki lang inyong vegetables. 4 to 5 servings of fruits and vegetables during the day is enough to maintain your caloric requirement. Carbohydrates, remember, rice has the highest glycemic index. Anong ibig sabihin nun? It has very high carbohydrate index and will increase your insulin levels. So, for carbohydrates in one meal, 1 serving, protein, fruits, vegetables, 1 serving each. What about your rice? Hindi isang mungkok ng kanin. 1 serving of carbohydrates is half cup rice or 2 pieces of wheat bread. So in a serving or in a meal, that will be half cup of rice or 2 pieces of wheat bread. And always remember, I always tell my patients this, I don't believe in intermittent fasting. Di ako naniniwala dyan. Kunwari, kakain lang kayo ng lunch, tapos matutulog na kayo, and magfa-fast kayo ng 16 hours. No, that studies show that will not reduce your weight. Studies show now that you will have to eat 3 times a day, but in small proportions. So, tandaan nyo, eat like a queen breakfast time, that is your heaviest meal. Eat heartily during breakfast, healthily during lunch. Ibig sabihin nun, kalahati ng kinain nyo ng breakfast, yun ang kakainin nyo ng lunch. Eat hardly during dinner. So kalahati ng kinain nyo ng lunch, yun ang kakainin nyo ng dinner. Tapos matulog. Matulog hanggang the following morning. That is fasting. That is your intermittent fasting. Huwag nang kakain, huwag nang magbe-binge ng potato chips, huwag nang magbe-binge ng balot, matulog na lang. So, 3 meals, 2 snacks in between is enough. Here in my slide, it says it's all about whole foods. Artificial sugars are taken away. Hormones, preservatives are taken away from you. Aim for the anti-inflammatory. Did you know? Mahirap nga to, mahal nga to. Kaya lang, strawberries have the highest. Yung mga taga Baguio dyan, they have the highest anti-inflammatory protection. So eat more strawberries, but only, again, as big as your palm. Not isang bowl of strawberries. Tataas naman ang blood sugar nyo. Vegetable, green leafy vegetables, whole grains, whole wheat are important. Studies have now shown that Pcos can be exacerbated by deficiency of nutrients such as iron, magnesium, vitamin D. So you should beef up or supplement with these: iron, vitamin D. Again, vitamin D has been very important now. That should be part of your supplements. Cut out coffee. Ang hirap sabihin to because a lot of us don't have to drink coffee because you want to stay awake. Frankly, honestly, I just want to share with you, I went through medical school without drinking coffee. Up to today, I don't drink coffee. And I survive waking up at 4 o'clock in the morning and then all the way and sleep at 9, 10 in the evening. And that is the lifestyle change that I incorporated ever since ever since I became a senior. Okay. What are the diets that you need to avoid? Sweetened juice, canned fruits and heavy syrup, starchy vegetables, potatoes, corns, and peas. You need to avoid white bread, pasta, bagels, and white rice. Wag nang mag-soft drinks. Wag nang mag-cookies. Okay, number 1, milk, cheese, and butter are not recommended. Look at this slide. These are the acceptable foods. Kumain ng saging. Especially large bananas, okay, are counted 2 servings of fruit. Remember, 4 to 5 servings of fruit or vegetables in a day. Okay? Green tea is known to be a potent antioxidant. Probably it's best to drink green tea than coffee. Now, turmeric is also found to have anti-inflammatory, and antidepressant effects. Now, there is a dietitian who said, for you to manage Pcos, you need to understand that everyone's needs are unique. There is no one-size-fits-all diet. You need to have your lab results. You need to know your budget. You need to know what are the food that are accessible to you. And remember, overwhelming misinformation online. Okay? So you have to be more astute and more discerning when you go online to see which foods are available and possible for Pcos patients. What about Pcos and pregnancy? Madaming nagtatanong niyan. Yes, it is possible. I've had many patients who have Pcos. All I needed for them was to lose weight. All I needed for them was to ensure that they exercise. And I helped them with their insulin-resistant problem. And by doing so, their menstrual cycles have become normal. And then we do the ovulation induction. If it does not succeed, it is important to refer them to the assisted reproductive techniques, to maybe reproductive techniques like keto, okay, or those IVF clinics, okay? Surgery, what about surgery? Before, what they used to do, surgery, they drill holes on the ovaries to remove those cystic follicles. But that is no longer acceptable because there are medications now that can treat the problem. And so, in summary, Pcos is something you are born with. Symptoms typically appear, okay, not until 20s or early 30s. Again, 4-pronged treatment. You regulate the mens, treat the insulin resistance, treat the hyperandrogenism. Diet and exercise have to be part of the treatment. You try your best to lower the risk of endometrial cancer. Follow up regularly, have your blood sugar test once a year, HbA1c once a year, glucose tolerance test every few years. Remember, there is no cure for Pcos, but you need to manage the symptoms. You focus on the individual concerns. You need to be mindful of the specific treatments that I have mentioned, involving medication and lifestyle change. And remember, it is not a death sentence, huh? I will always encourage to tell you it is manageable and you are part of the treatment. And so, thank you very much for listening. I hope I did some awareness and you have learned some points from this lecture. I would like you to follow me in my Aherrera Wellness Group page. I have a long list of lectures on Pcos, menopause, breast cancer, and I'd like you to stay tuned for the next series of my talks and chats in the coming year. Thank you again for the organizers, and thank you for this afternoon's event. I have enjoyed this very well. Thank you.
Okay, let us extend a virtual round of applause to Dr. Aherrera. Thank you, Dr. Aherrera, for your comprehensive presentation on Pcos. We are grateful for the opportunity to gain further insight into this condition. This certainly will help our nurses in understanding their important responsibilities in evaluating gynecological health. So, take away ko. Ikaw anong take away mo from the lecture?
So, yung una kong natutunan is that all races pala talaga is affected ng Pcos. And nabasa ko din na lahat pala na at birth meron ng Pcos, pero lumalabas lang siya in kapag of reproductive age ka na. Ikaw, may kakilala ka bang may Pcos or any insight mo sa webinar natin today?
Wala akong kakilala, pero insight ko, risk are higher pala if you have family history of Pcos, may diabetes or obesity. Yeah, no cure for Pcos, but you can manage the symptoms. Ikaw, family mo?
So, to be honest nga, two of my sisters talaga ay may Pcos. And natutunan ko din, or yung key takeaway ko na share ko sa mga sisters ko and other nga na may mga Pcos is yung lifestyle change. Very important siya. With moderate exercise, limiting yung carbohydrates natin, and enough nutrients para ma-manage natin yung Pcos kasi nga wala siyang cure.
Okay, that's nice. So now we will proceed to the question and answer.
Yeah,
We will
let's
open the
do
chat
that.
box for your questions.
Yes. I would like to answer the questions here.
So for our first question from our anonymous attendee, paano po pag ang cycle ko is ranging to 32 to 33 days? Considered po ba na may menstrual irregularities ako?
No, that's still within the period. That's why it is important to maintain 28 to 32, 33 days, that's fine. Okay, I'm happy that you are actually monitoring your cycles. Basta pag umiksi siya sa 25 or lalampas siya 35, 40 days, that is menstrual irregularity. Yun ang irregular menses. Okay? Next. Did I answer her question?
Next question.
Okay.
So for our next question, can Diane and Althea be given to patients with heart problems?
Heart problems like palpitations, congenital heart disease. Is that the question there? Diane and Althea per se can be given. It is safe to be given to patients, especially if you would want to treat the menstrual irregularity. But if there's an existing heart problem, then it should be well coordinated with the cardiologist. That's why when you say heart problem, you have to be specific. Is it a congenital problem? Is it hypertension? Is it palpitations? But per se, it is safe to give Diane and Althea.
So another question, Doc. What are some common misconceptions about Pcos that can lead to delays in diagnosis or treatment?
I'm sorry?
Common misconceptions about Pcos that can lead to delays in diagnosis or treatments.
Oh, wow, I'm happy. That's a good question. Very good. Okay. Misconception about Pcos. Okay, yan ang sinasabi nila, stress lang yan. They will always connect Pcos with stress. Pcos has become a wastebasket diagnosis. Ay, Pcos lang yan. So, because I stress lang yan. Kaya hindi na okay lang. Or tumataba lang ako. Or hindi lang ako nakatulog. That's why I have Pcos. It is important. Basta you have any of these signs where you gain weight, you have acne, you have excess hair, all these red flags na yan. Yung sinabi ko sa inyo, those are red flags and you should go and seek help and treatment for those concerns. The misconceptions are always denying that they're not sick, they're okay. And the number one denial or the number one misconception that I always see in my clinic is it is always connected with stress. That's why hindi sila nagpupunta. Okay?
Thank you, Doc. Thank you, Doc, for answering the question. Can we now proceed to the next? Next question we have here is, what is the connection between Pcos and mental health, and how can women with Pcos manage these challenges? Another one.
Yes, correct. I did mention that in my slide that the number one, okay, Pcos, okay, and stress, okay, stress from feeling all these or experiencing all these red flags, hairiness, excess growth, menstrual irregularity, tumataba, dumadami ang pimples, especially in women who want to look good. We all want to look good. If we don't look good physically, if we don't have that good physical image, that causes the number one factor of stress. Stress can lead to depression. As I did mention, it can lead to anxiety. That's why it is very important that women who have these symptoms, who have these experiences, go and treat and have themselves treated by a doctor. Number one. Number two, it is also important, okay, to also have support groups. Madami akong patients, they have support groups with their friends. They talk about their symptoms. Talk about it with your friends. Tell them what you feel. And maybe one of your friends would have already been treated, or one of them may actually lead you to a doctor who can help you. Those are the things that you can manage, okay, these mental health issues. Or I would say it's not exactly mental health issues, but it's all image related issues. The image related issues can lead to mental health issues. Did I answer the question?
Yes, Doc. Thank you for answering.
So for our last question from Miss Raquel, hi Doctora, I was diagnosed with Pcos last 2020. Then I tried to take pills and other medications, and due to the side effects, I stopped the medication. Nagtry ako to change my lifestyle, then this year I got pregnant during trans week. I asked the OB kung visible pa ba yung mga cysts in my ovary, then sabi ni Doc wala na siya. Is it possible, Doc, na mawawala yung cyst sa ovary?
Yes, congratulations. Because you made an effort to change your lifestyle, and you are a living testimony of how Pcos can be treated. Okay? You did not take the medications because you had all those side effects. Number two, you changed your lifestyle. You got pregnant. You got menses. Your menses got regular. So you ovulated. So when you ovulated, you had that egg floating in your fallopian tube, and then it got fertilized, you got pregnant, which is good. Nawala yung cysts sa ovaries. Why? Kasi nawala na yung hyperandrogenism mo. Nagamot na yun. Your follicles also now matured. So, nawala na yung mga cystic follicles doon. That, in effect, is the treatment. Your pregnancy was the treatment for your polycystic ovarian syndrome. Congratulations. Thank you for sharing, because that will tell the other listeners and participants that Pcos, if you manage your symptoms, will lead to a normal menstrual healthy cycle and may lead to ovulation and may lead to pregnancy.
Thank you very much, Dr. Annebelle. So I can see that our participants are really engaging and sending a lot of questions. But due to time constraints, we will be having our final question for Dr. Annebelle. So for our final question, how will my Pcos affect my chances of having a baby?
I think I did mention I had one slide about Pcos and pregnancy. First, you have to diagnose your Pcos. What is it? Is it obesity? Is it with insulin resistance? Is it with menstrual irregularities? You have to treat all that. But the number one, I think, is losing weight. I think that's the key in any disease, whether it's heart, Pcos, diabetes. Number one is a healthy weight. Losing weight is crucial. Okay, so that will actually treat it. And then if you notice, I think I have a slide there. You might have missed it. Losing weight, menstrual regulation, and then ovulation induction, diet. That's it.
Thank you very much, Dr. Annebelle, for your webinar and for answering our questions. So, a few of the questions po, Dr. Annebelle will answer in the Q&A section of our Zoom video na lang po. Because we cannot, we have time constraints po. So,
sure.
Thank you very much, Dr. Annebelle, for the webinar.
You are most welcome. Thank you for this opportunity to teach and to share.
Again, thank you, Dr. Aherrera. At this point, we would like to call Ms. Elsa Pasco, Nurse Manager of Delivery Room, to formally award our digital certificate of appreciation to Dr. Aherrera. Ms. Elsa.
Okay, the certificate reads, Nursing and Patient Care Services award the certificate of appreciation to Dr. Annebelle D. Aherrera in recognition of her valuable contribution as resource speaker during the nursing grand rounds of maternity services and endoscopy, newborn and pediatric services, entitled Navigating Pcos, Turning Obstacles into Health Opportunities, held via Zoom, given this 7th day of November 2024 at Makati Medical Center, Makati City, Philippines, signed by the Clinical Department Managers of Maternity Services and Endoscopy, the Newborn and Pediatric Services, Mr. Alexander Herbacios Sangoyo, Assistant Director for Specialty Nursing Services, and our Director and Chief Nursing Officer, Ms. Eda Bernadette Bodico.